of those human elements around data and is one of our network sponsors, has very kindly offered to lead this session. So thank you for joining us today, and I will pass over to you, and I'll keep an eye on the chat for you as you go along.
Lovely. Thank you very much. So, hello, my name is Tash Wilcox, so I'll put the obligatory picture of me, even though I'm here in, well, not in person, in the tiny box. So before I leap in, I'm just going to sort of give you a little overview of who I am. I'm the head of learning design at TPXImpact, and we're a digital transformation company supporting organizations to build a better future for people, places and planet. That is a lofty ambition, but that's what we get behind. I've worked in design, user-centered design, human-centered design, whatever you want to call it, design research, service design, and different areas of facilitation and leadership for about 25 to 30 years. So like I have seen a lot of change in this space over that time, but I do love my job and I've stuck in that space. I've had the pleasure of working with the NHS within sort of several different facets and the healthcare sector in general. But most recently, it's for the last 4 years, I think it has been, I've been in with the NHS and healthcare sector with the Topple Fellowship, doing capability building and with health and social care professionals in the area of things like agile, UCD, and innovation. But I am going to say we're not here to talk about me. So I realise I'm standing in front of a room of professional analysts to talk about qualitative design, which I suspect in a couple of places might give you a little bit of a mild acid reflux reaction, but you came here, so it's a good sign. And what I do want to do is open up. We might not have time for questions, but what we're going to do is we're going to ask you to put questions in the chat. If we do have time, I can answer them. But what I'd really love is time to take them back to the team, because I work with really incredibly intelligent people like yourself, and I think sometimes having a little bit of time to reflect helps us give better answers. So I'm just going to say, I feel sometimes qualitative design sometimes gets positioned as a slightly messy cousin of quant. That's my feeling. It might not be the reality. Quant deals with numbers and percentages and confidence intervals, and they're really, really nice, solid things. Qual, meanwhile, deals with people, with stories, with context, behavior, which can sound suspiciously like, well, opinions. So I promise I'm not here to convert anyone into qualitative researchers. I know you're all incredibly good at your jobs. The goal is, and I'll repeat this in the end, the goal is much simpler. I just want you to be able to recognize what good qual research is, what it looks like, and what it can actually give you. So I am going to start with a quote. This is Anais Nin. She did not work in design in any way. She actually wrote erotic novels, but she came out with some great quotes like this. We don't see the world as it is, we see it as we are. It is one of my favorite quotes. I totally overuse it, but I do think it's really relevant here. It might sound quite philosophical. I can never say that. I love the quote. Thanks, John. It might sound quite philosophical place to begin a talk about research, but actually it lands right in the heart of how both qual and quant data works. Because the way we measure the world is shaped by human decisions. A fleshy human defines the metric, another person writes the survey question, another person chooses the category and decides what gets counted and what doesn't. So what I want to talk about today is the relationship between quant and qual research, particularly when these two things can and often get framed as in opposition to each other. That's not what I think, but I do see it in some organizations. I don't know if it's in your organization or if you feel that too. So in some organizations, quant and qual are in silos. The organizations that do well find a way of making them work together. When I say making them, it's not forcing, it's about sort of like finding that really, really lovely iterative loop between the two spaces. There's sometimes a split between the two, a quant versus qual, as if one is more rigorous and real, one more useful, and the other is to add a bit of colour or humanity around the edges. And I don't think that framing helps very much. So again, that's in my opinion. It's sometimes what I see in the organisations that I work with. So where we should be is it shouldn't be quant versus qual in great organizations. Like I said, it's a team relationship. It's a team sport. It's more useful to look at it as quant and qual. Not in every circumstance. I do think there's circumstances where it doesn't work like that, but they do very different jobs. And in complex systems like the ones that you're in my opinion, we do actually need both. So part of the challenge is that quant often looks more stable, like I said, numbers or authoritative, percentage looks precise, dashboards gives us a sense that we can see the system clearly. There's something very reassuring about a graph. I'll admit I find graphs very reassuring. That appears to tell us what's going on without too much emotional messiness attached. But the thing is, quite often, most of the time, there is an emotional messiness attached. So, how do we actually work together? Effective collaboration between qual and quant research is a continuous loop. So it's that lovely loop that you can see on the screen between the two people. They do look a little bit romantic. I drew these and I might redraw them. They look a little bit like they're in love, but I want you to be in love. So effective communication between qual and quant research is a continuous loop, like I said, where each side strengthens the other. It can begin with qual researcher using quant data to identify existing patterns and hotspots, which helps scope precise research questions rather than starting from scratch. Once the qualitative work uncovers the why behind those behaviours, the findings should be brought back to the quantitative side to identify new patterns and provide a statistical scale necessary to influence high policy and decision making. So it's that lovely loop. It's not sort of like one and done or sort of like just passing it over, chucking it over the hedge. So part of a good research is forming this relationship and seeing it as both of your responsibilities to drive the research. You may be sat here thinking we don't have a user researcher or qual research practicing people in our team. In that case, it's about finding ways within your organization to drive the why question and say, I'm telling you what's happening, but I don't know why it's happening. So in the cases where you really don't know why it's happening, how can you drive that? How can you sort of like help the organization understand you need to understand the why? What I've done here is I've added a link. I will share the slides afterwards to an article on second discipline. So it's something we're practicing and developing in our organisation. And it dives a little bit more into working in teams where you don't have or do not have enough user researchers. So I've linked that in because it's a really big subject and we dive into it a little bit there. So one reason sometimes why quant is often given a little bit more authority than numbers is that the numbers feel stable. Percentages look precise. I've sort of mentioned this a few times, and dashboards give the impression that we can see the system clearly. And I'll not lie, there's a comforting clarity in that graph, like I mentioned, that appears to tell us what's happening without too much emotionalness attached. So I've linked again an article to Thea Snow. So as Thea Snow puts it, and I really like this framing, data does not just describe the world. In some cases, it stabilizes it, or at least I feel like it does. Quantitative data often presents itself almost as if it's saying, hello, I'm quant, I deal in facts, facts I tell you. And because of that, many organizations quietly evaluate quant over qual, trusting the hard facts while side-eyeing a little bit of the stories. But numbers are not neutral. They're not little objects that floated down from heaven. Quantitative data is designed, structured, constrained, and shaped by the very human decisions that I mentioned before. So qualitative data gets framed quite differently. It's often seen as rich and nuanced, story-driven and useful, but also somehow softer, more subjective, less solid and less qualitative research is doing uncertainty reducing work too. So it's all about that risk reduction. It's just doing it through stories, context, behavior, and lived experience instead of something like a spreadsheet or a dashboard. So again, it's sort of talking to the two things that live in people. It's that sort of like that data, the numbers, but also the story. It sort of helps speak to the sort of two pieces, the emotional and the sort of like more statistical. So really both are attempts to reduce uncertainty. They just reduce different kinds of uncertainty. And again, that's where the beauty of not either or thinking comes in, but both and. So going back to the quote, a reminder, we don't see the world as it is, we see it as we are. So a reminder, all research is shaped by perspective. The decisions behind the metric, a question, a category, a coding frame, a sample, an interview guide, all of that is human. So what I want to do is taking that phase at face value, how do you view qualitative design research? So there's a question there, and what I'm going to ask you to do, you can pop it in Menti. So if you don't want to put things in the chat, you can pop it in the Menti, or there's not that many of us, if you want to pop it into the chat. When you hear the phrase qualitative design research, what is the first word that comes to your mind? So to use Menti, you just need to take get the QR code, and it should just let you in. So I'll just be quiet for a minute while you have a little bit of a think. So what comes into your mind when we say qualitative research? It can be words, it can be a sentence. Brilliant. How and why? Psychology. Thank you. Any others? Motivations. Some sort of descriptive analysis. The patient journey. Really nice. Thank you. Stories. Lovely. Fantastic. So awkward silence over. So what's interesting is not whether those words are right or wrong. It's what they reveal about the role call has been given in organizations. It's often useful, often interesting, sometimes insightful, but not always something people feel confident making decisions with. And that is the part that I want to challenge a little bit today. So again, I'm not projecting this onto you. I'm not thinking that that's what you think, but I just want to talk about that a little bit today. So what does qual do? Qualitative research helps us understand meaning, behavior, experience, context, and mechanisms. It helps us answer questions like, what's going on here? Why is this happening? How are people making sense of this? What workarounds exist? What assumptions are operating? And what is breaking down in practice? And what does it feel like from the inside? So that's loads and loads of things. It helps us think about meaning, behavior, context, experience. It also helps answer questions like, what is happening here? Why is it happening? How are people experiencing the system? And what assumptions are operating? What is the friction? So it's really digging underneath the skin. It's like looking at the surface layer, but really sort of digging underneath to sort of like get that root cause. So what does quant do? What I'm going to ask you here is I'm not going to sit here and tell you how to do your own job. So if I asked you to sum up, what does quantitative design do? And I know you've come from sort of lots of different areas, but if you had to sum up quantitative research in a nutshell, how would you explain what you do? So again, if you want to pop it into Menti, I'll just put that on, or the chat. And again, just going to give a little time to think. Again, it could be words, it could be a sentence, whatever you want. Brilliant. Thanks, Chris. So spot trends, really nice. Analyze data, wonderful. Anyone else? Service user experience in their own needs, lovely. Demonstrating effectiveness of a solution, fantastic. Brilliant. Wonderful. I presume you know your own jobs. So I'm not going to go too in depth on this one, but qualitative research helps us understand scale, distribution, frequency, trends, variation, and it helps us understand questions like how many, how often, where, at what rate. impact analysis is coming in as well. So I think of scale, frequency, distribution, patterns, trends, and it helps us understand how many, how often, where, and what rate. Quant can tell us that 18% of outpatients are not attending their appointments. Qual can help us understand whether that is about transport, fear, confusing letters, caring responsibilities, language, timing, trust, digital exclusion. It could be many, many different things. I ran a session in Kent recently with some data analysts, and what was really interesting, we did a service journey with them, and one of them sort of went, I'm going to hold my hand up. I actually thought they weren't coming to the appointments just to be annoying. He was joking, but he hadn't actually really sort of thought about that human experience. And it was about widening it up and going, actually, it was that they couldn't understand the letters that had been sent out. It was transport issues. It was they had caring responsibilities. And it was a real moment in that room where they were like, I thought about this, but I hadn't really sort of seen the full human in that moment. So it was a really, really nice moment to sort of open it up and sort of see the two working together and have that conversation. So another quote coming up. I do like a quote. The thing is, what people say, what people do, and what people say they do are entirely different things. So that's from Margaret Mead, cultural anthropologist and author. And I find this a really useful reminder because both quant and qual can be distorted if we take responses at face value without understanding behavior and context. A survey response or a user interview answer or a data set is not pure truth. They're all shaped by our method, our framing, our context, and you will know that from your experience. So the issue is not which method tells us the truth. The issue is what kind of truth is the method well suited to uncover. Quantitative research helps us understand that scale, distribution, and frequency, and it helps us answer those questions. So, another little quick reflection. What I want you to do is just think about of a metric that you use or see regularly. What is the one thing that number cannot tell you on its own? So again, I'm going to ask you to either pop it in Menti or in the chat, or just have a bit of a reflection over it. So what are the things that that number can't tell you on its own? Yeah, blood pressure. My blood pressure is going up when I'm waiting for these answers. Yeah, the Y, lovely. FFT percentages, fantastic. Why the data reading is that way, brilliant. DNA percentage, yeah. All of these things. Maybe describe, see the whole picture of the output. Yeah, really, really nice. Again, Chris, it's that sort of like seeing that bigger picture. Socioeconomic backgrounds, wonderful. So usually what emerges really quickly is context or motivation. It could be sort of understanding the why. It's that bigger picture, what's happened around it, or whether the numbers reflects the things that we think it reflects, and what is exactly where qual, and that's exactly where qual comes in useful, not as decoration, but as a way of making better sense of what the numbers are showing us. So it's that lovely, like numbers are really, really important. They're really there. They tell us what's happening. But often the thing we need to make better decisions is why it's happening. So we can then pass it back into that qual and go deeper. So what's the context, motivation, experience, workarounds, emotion, what happened before? So I'm going to go into a couple of user research methods. There are lots and lots of qualitative methods similar to where you have your experience. You'll know there's loads and loads of different methods, and you can learn them quite easily. But a lot of the time, it isn't just the what, it's the why you're doing it. It's everything that wraps around this as well. So I would say I'm going to sort of go through these. And again, I'm not expecting you to sort of rush out and go, and I'm going to become a user researcher, but more sort of like think about what your user researchers or the people that you work with are using and why. So lots and lots. I'm only going to introduce 3 briefly, because the point isn't to turn you into qualitative researchers. The point is for you to become to help you understand how you work with them in your job. So in user interviews, these are quite commonly known. You probably have either been involved in a user interview, and if you do want to find out more about user research, I would say if you see things that are asking for people to research with, do go volunteer. If you're the right person, go and actually be interviewed, go and be part of it. It's a really interesting sort of learning to be part of those interviews. But user interviews, they are very common. They got even more common in the pandemic, when we were sort of like reduced to being in a room, not being able to interact as much. A lot of people got into user interviews. I would say that habit has stayed a little bit, and it's starting to break down now. Good user researchers, for the right reasons, get out of that room. They get out, they speak to people, they go into the space and place. So a user interview, what is it? It's a one-to-one conversation. A researcher meets with the participant to explore their experiences, behaviors, and needs. Interviewers help uncover both what people say explicitly and the underlying context behind it. The researcher interviews the participant about the topic in question. Interviews allow you to gather a lot of information about user needs, both explicit and implicit, through direct and indirect discussion and understanding the context. I am going to say it's not just a chat. Somebody said that recently, where they're like, oh, well, you're just having a chat. It's not a chat. A lot of planning goes into these, from who should actually be interviewed, where, when, why, and most importantly, what are the agreed questions needed to help us move forward as a team. The researcher does not write these questions in isolation. So researchers should not work in isolation. They should be working with that multidisciplinary team, and they feed in and feedback on the questions, on the needs. What's the outcome you're looking for? So when to use, interviews are an essential tool throughout the design process. They help you conduct you need a clear objective, a discussion guide, note takers and note taking documents, and a plan for analysis. The facilitator or note taker, and sometimes an observer from the wider team, should ideally feed into the analysis with the researcher leading. So again, it's not just a researcher doing this on their own, it's a team sport. There are risks. So there's lots of risks in user research. And that's why when we sort of talk about user research, I would always go and speak to a user researcher. If you want to try doing a user research interview, fantastic. But go and speak to somebody first, because there are lots and lots of risks. It can be done really badly. So leading questions, framing, and power dynamics of the interview setup can result in bias. Without a clear discussion guide, structure linked to the research objectives, semi-structured interviews can really, really go off topic. And I will be very, very honest, when I first started out in this world, I did some research interviews. I was awful. I would go off topic all of the time. And then when actually I bought the research back, we didn't have what we needed. And then you end up creating a burden on those users. And if they're vulnerable users, having to do those interviews again is not appropriate. So you could also have a great interview, but if the questions are not aligned with the needs of the project, business, or team, it's completely pointless. So again, it's not just a chat. Often we pair the researchers with the interaction designers and or the content designers early doors on a project to make sure it's the right things to ask in the context of the project. Ethics and safeguarding issues, especially when discussing sensitive topics with vulnerable communities. And recording isn't always possible. So a lot of the time you're either in person, but you can take recording devices, but it's not always possible. A lot of people decline having it recorded. So a note taker might need training to accurately capture it without bias. So again, the person taking the notes is as important as the person asking the questions. But done well, they can bring loads. So, depth of insight, they allow you to explore experiences, behaviors, and motivations in detail, going beyond that surface level answer. So, what we said, it's about really, really digging down. What's the root cause? What's the why underneath that sort of first answer? Understanding context, you can ask follow-up questions and probe how people actually work, how they think and feel in their real environments. So you don't just have to sort of be online that we are now. You can go into somebody's home. You could do a one-to-one interview within their environment. Uncovering implicit needs. People often reveal needs, workarounds, or frustrations that they wouldn't think to mention in a survey or analytics because they're not going through the motions at that time. So, again, it's sort of pulling on different threads, both things working in conjunction, making each other better. Flexibility. Interviews can adapt in the moment, allowing researchers to explore unexpected but important insights. And building empathy. Hearing directly from the users helps teams understand the human experience behind the data and the decisions. And again, a little bit of personal experience here. I actually had a stakeholder. I trained them up in note taking. It was sort of, we did have an extra note taker there. I actually took a stakeholder to a user interview just so they could hear the words of that user sort of in the moment. They got loads out of it. They were really, really invested um, in the project and in what we were doing because they actually sort of like were in the moment. They heard those words from that user. And again, sometimes it's sort of if they're okay with it can be recorded. Another example was we I can't say the company. We were working with an organization and one of the interviewees cried and was just like, tell them that this is that frustrating. Tell them that it affects me so much. And it had been recorded. We asked permission, and again, we showed it to the stakeholder. We had told the stakeholder this about 1,000 times. We showed them that video, and they said, why did you not tell me this? Because they saw the reality. They saw that user. They saw that human suffering. And you put it into words in a way that we could never have put. So, one-to-one interviews, fantastic. Going to jump into diary studies. So, what is it? Diary studies are fantastic. So, a researcher issues like a journal, either physical or online, to participants, which includes questions or prompts for them to complete over a period of time. Diary and studies invite all forms of recording attitudes and behaviors, such as text, sketches, photos, and recordings. So, I'll give you two examples here. There's one on the next page, but I worked in Salford. We worked in a community and we actually were working with young children, and we had a session where we got a photographer to train them up to sort of like talk about how to take photos. We did a little bit about ethics and who you can take photos of and why. And they went out and used that as a diary study. We did reflections around the photos. And then the most fantastic thing that came out of it as well, that really sort of like gave them a sense of pride, was the Lowry agreed that they could do a small exhibition in the sort of walkways as well. So they had this sort of wonderful moment where they were exhibiting in the Lowry alongside sort of famous artists. But it was this sort of wonderful thing. They really, really got into it. So it's going into the community, really sort of like getting them involved, getting them excited about it. And we reach the outcomes that we need to do as well. So diary studies can really help us understand experiences over time instead of asking someone to remember everything in retrospect. That's really hard. We capture events closer to the moment. It's incredibly useful in healthcare, for example, because so many services unfold across time. There's appointments, there's waiting, there's follow-ups, there's results, there's referrals. Also, you're going through the healthcare system. You're probably not feeling well. You're probably in a different emotional state. So having these sort of diary studies that are just sort of like gentle nudges that you can do in a way that suits you works really well. So what looks like a single transaction in a data set might actually involve weeks of uncertainty and work for the patient. So diary studies help reveal hidden effort, repetition, waiting, confusion, and cumulative burden. The limitation is that they require effort from the participants and data can be patchy, but when they're done well, they reveal parts of the system that are otherwise invisible. The effort bit, So when we used to do more paper ones, we used to call it car park diaries. So I was working in a community centre, and we would go out waiting for the participants to come in to share their diary studies, and you could see people duck down in their car, and we know they were filling it in then. So it does have its limitations, but when it works well, it works incredibly well, and I've got an example coming. So when to use: diary studies are useful at the beginning of projects or over the course of longer period of time. They are done with relatively small sample size of participant groups to ensure moderated facilitation. The synthesis of a diary study data is useful inspiration for generative designs, and likewise the method itself can form part of participatory design research approach. The risks: the onus is on the participants to complete them. Like I said, you have those little car park diary moments. And sometimes it's over relatively short 3 to 5 days or long periods of time. So it could be weeks, it could be months. Participation requires typically wanes after a while. Such methods are reliant on self-reported data. So that it's not factual, it's that self-reported data, which might not be reflective of their true behaviors and attitudes. So there might be misinterpretation in tone or intention. So these are fantastic if done well, but they do bring risk, like anything. So diary studies done well: clear prompts and guidance so participants know what to record and why, short manageable duration to maintain engagement, regular check-ins from the researcher to encourage participants and clarify entries, those little nudges that they might need. Simple ways to capture entries. So like I said, it could be photos. We did one with voice notes that worked really, really well. It was a sort of a generational thing. They love a voice note. So they were like, yep, we can do the voice notes. Or it could just be quick text. What works for the human that you're working with, not what works for us. Thoughtful synthesis to identify patterns across entries and connect them to research goals. Like I said, I've been working with the Topple Fellowship recently, and this is a lovely short example from one of the Topple Fellows. Basically, one of the fellows was struggling to get time and have one-to-one. So she actually wanted to do one-to-one interviews with the care home team and especially the night staff. But the night staff are working really long hours. She didn't want them to have to stay longer to do it. They couldn't do within their working hours. Plus, in many cases, English was a second language, so there was a language barrier there. There was low digital literacy, so they were struggling to get them to do online forms, and they had no time. They worked really long hours, and there was no funding to pay overtime. So we actually were talking about diary studies with the fellow, and we had a one-to-one afterwards, and she realised in reality she could probably, in this circumstance, get most value out of doing it this way. So, as to keep it simple and reduce that burden that I mentioned, we don't want to add burden to people. She added 3 questions to their daily log. So they had to write a daily log every day, and they had to complete it before they left. It was a little extra reflection, but not a separate thing to do. And the diary study, not all, but the majority, the diary study worked really, really well. It was basically the majority filled it in with a in daily without any friction. So she found that really, really useful. And again, she actually got what she needed. So it helped her see that bigger picture and the pain points. It became, in some cases, more honest as it went along. She did it over several weeks. It became more honest as it went along. And she tracked in real time rather than from memory. Sort of imagine trying to do that interview at the end of a really long night shift where you've sort of been caring for people and trying to remember sort of what you did over the last few weeks. So that worked really well for her. So going into number 3, so this is the last one that I'm going to go through. So observational research methods. And in this one, there's an overarching theme because it's about understanding behavior in context. So a couple of these. So many design research methods involve observing people in their real environments. And when I was speaking about the one-to-one interviews, you heard me sort of say it's not just about sitting on a computer asking questions. Go out, speak to people, see where they are in their working conditions, in their homes, etc. So And it's really important because if you go into the observing people in their real environments, you can um, understand what they're doing at the moment rather than recalling behaviors afterwards. So similar to diary studies, it's sort of in the moment, but you're in the moment with them. So three common approaches are ethnography, deep observation of people, communities, or cultures to understand shared behaviors and norms over time. Contextual inquiry, observing and asking questions while somebody performs a real task in their environment, and place-based research, exploring how a particular environment or location influences behavior decisions and outcomes. The photo here is from a project I did with the girl guiding. So we were actually in with some brownies here. So you can see we went into their space. My colleague is not incredibly tall. All of the furniture was very, very small. So yeah, we were sat on the small chairs. We were with them, sort of like we saw how they interacted with each other. Incredible bit of research. So when to use? Second. When environmental or context strongly shapes behavior, when people may struggle to accurately describe their behaviors in interviews, in early projects to understand real world practices and influences, and when you need to see what actually happens, not what people say happens. So remember that quote from Margaret Mead. Again, there are risks. There's the observer effect. Imagine if somebody is watching you do something, you sometimes change your behavior. So we have to take that into consideration. So sometimes you might do it over a series of weeks so that they get used to you. So need to think about, people might not behave in the way they usually behave if somebody is watching them. So you've got to think about how you do it. Can you do it in different ways? Limited time in the environment can lead to a partial understanding. So you only see a little bit of the picture, you only see that sort of like moment in time. Ethical considerations, as always, there's those ethical considerations when observing in sensitive settings. And interpreting, that's the right word, interpreting behaviors incorrectly without sufficient context or triangulation. So it's about getting the right people in the room, understanding it, sort of having those conversations afterwards. Done well. So done well, observation helps reveal workarounds. So they might not talk about the fact that, well, I can't really do it that way. So this is the actual way I do it. Those hacks, those ways that people sort of find to make something work. They don't feed that back into the system. They might not mention it in a one-to-one because they might go, well, I might get in trouble if they find out I'm doing a workaround. But actually that's super, super important. Those informal practices, the interruptions, the coordination work, the environmental constraints, all of these through this work can be unveiled. It can reveal behaviours, it can show how environment, systems, and context shape decisions, helping researchers understand why behaviours occur in practice. It can surface hidden factors that explain patterns seen in other data. So again, it's the beautiful work that you do. You're spotting those patterns, you understand that data, but helps strengthen insights when combined with that quant and qual working together. And in healthcare settings, this can be incredibly valuable because much of the system runs on adaptation. Staff make systems work through constant adjustments that rarely appear in a process. It might not appear in a diagram. So it's about understanding the actuality, what's going on. Observation can reveal the sticky tape holding things together. Its limitations are that it's time intensive and context specific. So it does take a lot of time and energy and a very context specific, but it can expose mechanisms of the system. So a little example, and I'm going to ask you a question. So this was the childhood obesity trailblazer. So we did some research and it was place-based. So we went into the local high street to try and understand this question. Why would walking to school be more of a negative influence on children's health than being driven or getting the bus? So why do you think parents thought walking to school would be more of a negative influence on children's health than being driven or getting the bus? So pop some out. Yep, lovely, coming in already. Pollution, opportunity to pick up snacks on the way. Any others? Any other guesses? Less interaction if walking alone. Thank you. Bullying. Yep, really interesting. Mixing with the wrong crowd. Any others? Cool. I am going to be honest. Who said it? I think it's Leonie. I went pollution all the way. When we first did this, I was convinced it was pollution. It was not pollution, but you did get it because your second answer was the correct answer. So, a council noticed children were being driven to school rather than walking, despite initiatives to encourage active travel. So, the whole idea was like, get kids walking to school. So, when our research looked more closely at the local environment, they discovered something important. The high street route was full of shops selling unhealthy snacks. So, you nailed it on that one. Parents worried children would buy junk food on the way to and from school, and to avoid this, many parents chose to drive instead. And this revealed a system paradox. Attempts to increase physical activity failed because the local food environment shaped the behavior. Understanding the place, not just the people, helped explain the pattern. That's not to say that you mentioned bullying, mixing with the wrong crowd, less interaction if walking alone, etc., etc. They might have been part of it. It's not like that was not part of it, but this was the main thing that surfaced in this space, and it's super interesting. So, like I said, when we came into this project, my assumption was pollution, and that's all I could think. So, if we'd done it without this deep dive, we probably wouldn't have got the ideas that we needed. So, good qualitative research is not just we spoke to some people, we had a lovely chat. It's deliberate. It starts with clear research questions, chooses methods that fit that question. So it's not a sort of like, well, we always do one-to-ones, we'll do a one-to-one. It's about understanding the methods at your disposition, which ones work in that environment with those people. What are the needs that we have? It has a rationale for the sample, uses structured guides or tasks, and that analyzes findings systematically and acknowledges limitations. And crucially, it connects insights to decisions. It does not pretend 5 interviews represent everyone. It does not claim certainty when it does not exist. So it's very, very different. We work with very small numbers. Sorry, 1 second. So we've got last 2 questions. So if someone presented qualitative findings to you tomorrow, what would help you trust the work? So if we presented qualitative findings to you tomorrow, what would help you trust that qualitative finding? I was sitting here going, they trust us. This is wonderful. But you don't trust us. So I thought I was about to read mixing with the wrong crowd then as well. So validation of findings, details of the methodology, robust methodology, wonderful, evidence to back it up, fantastic. The source maybe, credibility and reliability, lovely. So I have asked you for a slightly Machiavellian reason. I'm going to feed this back into our research team because the better we can understand your needs, the better we can work. It's the shoddiest bit of research you're ever going to see. So don't take this as good research. But what I want to do is just sort of like take a few of these sort of thoughts back to our team. And the last question is to the room is, whoops, I'm sorry, is what is one thing that you feel is misunderstood or not understood? I've put this really weirdly. Sorry. What is one thing that you feel is misunderstood or not understood by qualitative people? So qualitative research around your skills. So What is it that you feel gets misunderstood or misrepresented by qual researchers of quant work? That's what I should have written. I apologise. And again, I'm going to take this back to my team. And we're going to do a follow-up that we'll send out in the newsletter. What's the things that we do that really grinds your gears? You can't upset us. Put it in the chat. Lovely. Not looping back to how the research will impact care. Lovely. Thank you. No robust association or way of transferring the information to. Fantastic. Really great. I'll leave that open. If you don't want to put it in the chat and you want to keep it anonymous, you can pop it in the Menti, or you could just follow up in an email afterwards. So don't feel that you can't add to this, and we can have them anonymously as well. So I'm just going to wrap us up. 1 second. Right, so wrapping us up with back to that quant and qual sweet spot. So I want to finish where I started. The point of this talk is not to persuade a room full of brilliant people who are fantastic at their jobs to become user researchers. That's not the goal. The goal is something much simpler. I want you to feel confident recognizing what is good qualitative design. What does it look like? I want you to be able to ask better questions of it. I want you to be able to challenge weak qualitative work, and I want you to be able to make use of strong qualitative insights when it exists, because good qual research can give you things quant cannot, and vice versa. They work better together. They add more value and impact together. Qual can help explain behavior, reveal hidden assumptions, expose barriers inside systems. It can show what services actually feel like for the patients and staff, but it has its limits. It cannot tell you prevalence. It cannot represent entire populations. It cannot and should not replace quantitative evidence where scale matters. What it does is add depth and mechanism. And in complex systems like healthcare, that combination is incredibly powerful. Quant helps us see where the problem is. Qual helps us understand what the problem actually is. And if we want to make better decisions in healthcare systems, we need both working together. It's that beautiful iterative loop. So on that note, I am going to say thank you. Thank you for interacting in the chat. I know when you're on a bit of a lunch and learn, somebody asks you a question, it can throw you off a little bit, but thank you. Feel free to say hello to me. I'm happy to answer questions or connect you to people who can answer those questions. But from me, that is a wrap.
Awesome. Thank you, Tash. We'll give people a second. Looks like there's a couple of things being typed.
Just it. I'm going to slide out. We're going to
Yep.
pop. Oh, we're going to pop an email out after. Is it going to be an email? We'll pop something out, and if you do, if you've got questions. Oh, is it Leonie? My screen's really small.
Yeah, it's me. Hello,
Hello.
Tash. I just want to say thank you. That was really helpful. I myself am not a quantitative analyst. I work in a health inequalities team in a local ICB, so really keen to see today how you're bringing together the qualitative and quantitative, which feel essential for the work that we're doing. And I'm just wondering, do you have any methods, tools, or approaches that you would recommend in terms of bringing the two together at that point where they intersect?
So you asked this in the pre-questions, which I got yesterday.
Did.
So I have basically, I'm speaking to my head of practice in design research because she will give you a much deeper answer than I will. So that is on my list already of answer this. So we'll follow up as soon as possible with you. But what I'll do is I'll write down, if it's okay, I'll write down your name as well so I know who to point it at.
Yeah, that's absolutely fine. And thank you for today. It's great
Thank
to hear
you.
that. Thank you.
Lovely. But that is one of the ones that is definitely on the list to answer. So thank you for great question. And Elsie, oops, sorry. I'd love to know from the experts the best way to present qual research. That is a big question, but again, let me take it back because I'm going to be really honest. When I finish a talk, if you ask me a question, you get a really short, rubbish answer because I don't have time to think. And we've only got 7 minutes. So what the plan is, we will harvest these questions. So if you do want to ask questions, ask them in the chat now. We're going to harvest these and we're going to give you a little bit more of a rounded answer and we'll write it up. So it's more robust than the whittering of my brain after a talk.
Perfect.
Brilliant. Let's give them. I'm going to be one of those people that goes, you can have 6 minutes of your life back if you want.
Yeah, absolutely. If anybody does want to add a question to be followed up afterwards, the chat will remain open, so you're more than welcome to leave comments for the rest of the 6 minutes, and we will collate those and get back to you. Otherwise, thank you very much for joining us today. And thank you, Tash, for your lovely presentation. Definitely learned a lot, so really appreciate you joining us. And yeah, look out for the next AphA magazine in May. There will definitely be more information on this for you to round up some of those questions. So thank you, everybody, and see you next time.
Thank you. Lovely to meet you all.
Bye.